Hello, welcome to a great presentation today. Exciting to speak about transforming healthcare through data-driven insights. I'm your host, Eric Sullivan. I'm Inovalon Senior Vice President for Innovation and Data Strategies, where I lead new and emerging products, our focus on interoperability and AI. But to really foster an exciting conversation today on where healthcare is going and the trends in the industry, we are joined today by Nitin Naik, the Global Vice President of Transform Health at Frost Sullivan. So to jump right into it, Nitin, maybe you can give the audience some background on what you're seeing in the industry. Talk to us about the trends that are driving all of the activity that we're all seeing on a day-to-day basis.
Hi, good morning, good afternoon, everyone, and thank you, Eric, for inviting me for this exciting discussion. It will be a pleasure to speak about some of the very important trends and also what it means to some of the key stakeholders in this industry. So really, let's start looking at what is driving transformation. Healthcare is really a dynamic and a opportunity-rich industry. There is lots of innovation, and primarily most of that innovation has focused on health outcomes. However, that equation is changing. There are more and more conversations from patients, physicians, and providers about quality, affordability, and access. So we believe these conversations are also going to be important in bringing innovative technologies and changing workflows to make that possible. So let's start with looking at predictive and prescriptive medicine, which is really the basis for which precision health and the entire way the treatments are delivered, including in bringing in new digital partners. So what do we really mean by precision medicine and prescriptive analytics? Really, it is an evolution of the healthcare industry in which the traditional information is now being represented into new data points, including genetic data, omics data, and really the whole objective is to match the right patient with the right treatment at the right time. And we believe this is really the future where essentially anytime, anywhere care will be delivered with a whole lot of transparency around information, be it clinical information or at the same time social or socioeconomic information. And that's the future, which is very exciting for Frost & Sullivan to start looking at what is that connected ecosystem, be it in terms of pharmaceuticals, life sciences, clinical diagnostics, or medical devices. If I may now spend some attention more specifically to the life sciences industry, and this is important because not just in terms of the dollars as well as the footprint, but also the maturity of this industry to enable that innovation to the fullest scale. And at Frost & Sullivan, we have identified what we call as digital pillars to map that innovation. And in this slide, I wanted to just talk about really 4 key pillars, which are actually not just mature, but also really changing the behavior in which companies are forging partnerships. So these are really very collaborative partnerships to improve the scale of innovation and patient treatment. So let's look at R&D. So in terms of R&D, you have the ability of relooking at how drug discovery is done, not just in the research labs, but also in hospitals or partners such as CRO. And this is where we believe AI can make a big difference. Specifically, there are 4 applications including early stage clinical development, clinical trials, real world evidence, and the commercial and the operational analytics, which has experienced lots of growth. And we foresee that to actually grow at a significant higher double digit in the next 3 years. Big data and cloud computing, which has actually been the cornerstone of improving innovation, continue to bring that change. Cloud computing in particular is really fascinating because it just provides the platform for different technologies, be it mHealth or telemedicine, or also even other social media analytics platforms to make an impact. There are several use cases, but we have seen use cases in virtual or hybrid trials make a big difference because there is significant cost savings to the tune of almost 15 to 20%. So those are really some of the key pillars which are seeing investments, and we clearly foresee lots of growth opportunities for companies to make a difference. And when we look at companies like Inovalon, I think they have clearly made big headwinds in positioning their platform and their technologies to get to that pivotal change. So one of the core aspects when you operate in such an environment is not just looking at massive data sets or bringing in that richness or of data volumes, but it's essentially the importance of also providing exceptional clarity on different tool sets and how those data sets could be visualized. One of the frequent challenges we hear from physicians and patients is there's tons of data, but how do you make very simple sense of that data, and lots of very simplified dashboards and tools. So, with that starting point, and then obviously the ability for that data set to convey the impact, be it on pharmaceutical drugs or diagnostics, and improve that outcome-based health conversation is a big change, we think, where Inovalon can make a big difference. Let's look at how companies are trying to unlock value, and of course, there are different ways in companies are having that conversation. I think one of the more easier conversations is really when you talk to providers and really help them prioritize or reallocate resourcing. Yeah, and this is an important conversation, even in current times when most of the payers and providers are really being challenged to look at making decisions between elective or non-elective treatments, for example. The second, I would say, really important point is as companies are going through this hyperloop of really accelerating the care in a virtual environment, more and more stakeholders need to be essentially be prepared and embrace this change, not from a technology point of view, but also from the way they are changing the mindset of the staff, the physicians, and the patients to really improve and utilize this tool. So where do we think is really the future headed? Clearly, environments which are going to be enabling the smart care, be it in home or in hospitals, and also where some of these platform technologies can help making decisions around prescriptive care. So again, pretty exciting environment, and we believe this is an exciting opportunity for Inovalon. So I'm going to hand over back to Eric and let him discuss some of the key trends from his perspective. Over to you, Eric.
Great. And thanks, Nitin. It's a really good overview. Appreciate your lens on the industry and excited to have a chance to speak with you on this topic. I mean, at Inovalon, we, like everyone in the industry, trying to address the quickly evolving industry from digitized medicine devices, virtual. I mean, we're all virtual at this moment on this discussion today, and how to really drive change and improvement in patients' lives with all of the variables that are kind of compounding all of us. So when you think about how we look at it we look at the industry and kind of break it into four larger categories. I mean, obviously consumer is underlying all of this, right? The impact of payers and providers and pharmacy and life sciences on ultimately the most important stakeholder, right, which is the patient. That's really the key. And when we think about it at Inovalon, we made a transition a number of years back, moving more and more of our capabilities into different cloud environments, commercial clouds. The key has been to ensure that we address a lot of the areas that you discussed just now, right? So ensuring that as we work with payers, leveraging the latest, kind of combining all the aggregate data sets together, that we help them to be successful in terms of improving quality for their patients, improving engagement, leveraging the latest technologies. I'll hit on some of this in a minute. But the same thing with providers, as you mentioned. Providers have a finite budget, right? So health systems, they are trying to manage just core day-to-day costs and challenges, but at the same time wanting to stay on top of the latest of technologies. So how do they prioritize it? How do they find the right partner to bring them along in that journey? That's kind of where Inovalon is focusing with its payers and providers and even some of the pharma and life sciences, is helping them leverage the most of their data, be innovative and yet lean with how they think about leveraging the technology to intervene and engage with their patients or members. And that's kind of that's the balance, right, that we're all focusing on is staying with the innovation, the technology changes that are rapidly occurring, from our smartphones to everything else around us, and at the same time, we just got to get the day-to-day business done. And how do you solve for both of those at the same time is always a challenge. When we're looking at it, and more just to frame up kind of, and this is I'm sure for those that are on this call, everyone kind of thinks about it in a lot of the same ways, which is the first step is to ensure that you have the right information, right? So it's the connectivity, the interoperability, and then you hit on kind of the concepts of connecting with devices and doctors, EHRs, et cetera, connecting all the dots, making sense and normalizing, as we speak a lot about today. The newest buzzword is curation of the data, but making all that data become information, right? And that information becomes a holistic view of a patient from which you can analyze, leveraging artificial intelligence, natural language processing, machine learning, deep learning, right? A lot of these different areas. But as Nitin, you spoke to the concepts of prescriptive medicine, which is a really exciting term. I think it kind of is the next evolution from precision medicine. Right now, you're really getting more prescriptive at the patient level, more than just genomic information relating to oncology treatments, but really the whole scope of care of the patient. But really having the best of analytics and underlying information and data to drive that prescriptive medicine that you described. And then what do you do with information, right? So I think the industry, from health plans and providers and health systems, the 3 decades I've been in healthcare, this challenge still persists, which is with all the best information you have, now it's even better, more complete, robust, everything that you can do with that data, many sources. But then how do you intervene with the consumer? How do you get them, the consumer, to change, to even hear what's going on with them, because we're all busy. So I think that's definitely a persistent challenge, is that intervention, that third kind of pillar you see on the presentation here, intervening through SMS and phone and traditional routes. But then you think about consumer devices, and as many here are aware of, the interoperability role, and Inovalon has its consumer health gateway solution supporting that. It's really, how do you leverage that FHIR an API data model, if you will, and approach to exchanging data, standardized data, and get it into consumers' hands. So they're in their Fitbit device. They see what is going on with them from the world outside of their home, right? Which is, this holistic analytic view of what the risk may be. Do they need to go back to their doctor to get their diabetes checked? Do they need to take this medicine or get this physical? So I think that intervention is a really key part, and obviously as you mentioned, the ability to visualize it, right? That business, bringing it all together within a visualization layer is key. The interoperability is a big part of the digitized medicine view, which is combining the world of claims and clinical and device data, bring it all together into this digitized kind of patient 360 profile. Having the right interoperability approach is going to be critical for Inovalon and all of its customers, but certainly for, I'm sure, those on the call. Again, a lot of this goes back to making the right approach to expanding your connectivity, thinking through what is feasible, right? We have finite budgets. We have to prioritize, what can you build versus who do you partner with to expand and have all those connections so you can build the right profiles and then drive that prescriptive medicine and then mass data, right? So we're very focused at Inovalon, as I know many are, on ensuring that you have built a large, comprehensive, massive data set to inform your AI models, to inform the approach to digitized or prescriptive medicine with as much information, relevant and clean, valid information as you can. So the answers that you get and therefore then the direction that you're taking your platforms and your solutions to engaging your patients is not misdirected, but it's informed by the kind of a very deep, robust set of information. So I think that the key of having a large data set to train where you're going, right? Train your intelligence, train your models is an important part of it. It's an important part of our equation. I assume it is for many. If I can, I want to just hit on two use cases, and then I'll kick it back to you and to kind of take this home in terms of trends and where we're going from here. But two exciting areas that Inovalon has been focusing on. One is this concept of, with all the information we have at hand for our payers and our provider customers and others, how do you take that information and expose it to the right, in a secure, very controlled manner, expose it to the right stakeholders so care can be improved and patients' outcomes can change, and hopefully the cost curve can go down, right? It can inflect the right direction. So, we launched in the last, year and a half, 2 years, a FHIR-based API gateway to support a large part of the specialty pharmacy industry. And what that gateway does is, if you kind of look at from the left to right on this image here, you have an end user. So this end user could be, as it's described in the interoperability rule and patient access API, it could be a Fitbit app, but it could also be a specialty pharmacist. It could also be your primary care doctor. It could also be another payer, right? As we think about the payer-to-payer exchanges that will occur over the next, 18 months. But we've created a cloud-based API gateway that has those layers of application and consumer authentication. But what it's really doing, which is a sign, it's just very technical, what it really means is that we can finally take information we have in-house, from a payer perspective, from a physician perspective, bring it all together in real time, produce that holistic patient, 360 view, maybe perform some analytics on top of it. So I'm focusing on the middle box here, in real time, and bring that intelligence and bring those insights directly into someone's hand, right? So if you have a smartphone in your hand right now, how do you bring that information right into someone's hand and say, hey, Dr. Smith, this is what's going on with patient Eric, or hey, patient Eric, consumer Eric, as we would say, here's what's going on with you. How do you take that information, leverage the best of AI, the best of real-time analytics, and it kind of going back, Nitin, to your point, kind of creating that prescriptive medicine channel. Now technology and CMS is driving this, which is sometimes it's good to have top-down drivers, driving the industry to really embrace this real-time, secure, and standardized data exchange. And that's critical. So I think it's an area that we're tapping onto many use cases here, not just interoperability world, not just specialty pharmacists, but many other use cases we are now leveraging this capability with. And then the second one I wanted to mention, which goes back to my earlier comments on artificial intelligence and fall risk, is when you think back, and this year, you think back to, there's been in healthcare long as I have, 25 years ago, and disease management, was kind of the big buzzword in the 90s and early 2000s. And you had these teams that would try to cobble together who was at high risk, and it was all done in more a population level with very high level, kind of vanilla view of the world. And then what would you do with that? You'd have a nurse that was on the phone, and he'd be try to make an outbound call to a patient to say, we think you're high risk, off of likely very stale data, off of very poor analytics, and that often didn't go so well. So I think that was kind of the legacy model. What we've really seen in digitized medicine today is a transformation where now, with large data sets, you can train very, very deep predictive, in this case, we have a fall risk as an example here, predictive model based off of machine learning that uses billions of clinical events to say, does this very specific patient, what is their true risk, of falling? What are the drivers of that fall risk? Is it a medication? Is it a recent inpatient or ER visit event? What are the drivers? And then take that information, present it in the visualization layer for a care management nurse, a physician, but also present that information and be able to kick it through, as I just described, an API gateway to deliver that directly into a physician's EHR. And so when they're meeting with you in your visit, the physician will have this deep, holistic, and very accurate, meaning, it's not, the highly positive, correlated insights about that patient's risk. And bring it in real time. It's real data, not stale, claims and clinical combined with the best models trained from the largest data sets. That's where digitized medicine is going. And I think that, Nitin, to your point, I'll hand it back to you, but the concept of prescriptive medicine, the concept of leveraging digitized medicine and doing it in a way that's thoughtful, you can prioritize it, but you stay on top of it. Or that's the key, and that's really one of the biggest challenges. Our goal at Inovalon is to bring that to market, to drive value for our customers, ultimately driving better outcomes for the U.S. patient base. But there's still many challenges to go, and I think I would just hand it back to you. Maybe you can talk through what you're seeing is, what are the industry trends as we sit here today and we're thinking about, what I just described from Inovalon's lens. I think which probably many would share what I just described. Where do you see us going? What should we be thinking about what's around the corner, 2 years from now? Maybe it's hard to guess, but I'd like to get your thoughts on that if you can.
Thank you, Eric. I think, it's a fascinating journey, for me to see as your company has pivoted from, established models to some of these very innovative use cases and more importantly, this seamless integration. And that's what I sort of want to, talk about. Really, as we have been speaking to different stakeholders, pharma companies, device companies, all of them are really rushing to, be a part of this consumer-centric care. There have been, they definitely have had advantages by working with, companies like you who offer these tools. But really, the big rush is to get a deeper understanding of the patient journeys. And you probably hear this conversation, more often times. I'm probably having, these sort of discussions of even, what does it mean, for us to establish a patient journey. The reality is, it's early days. The industry is really stretching to put the meaning in the context, because the journey for a cardiovascular patient could be completely different to a diabetes patient, right? And healthcare has been in somewhat operating in a silo, just kind of taking a more broader based approach. But this is, I think, the right time for the industry to start getting to those optics to give a real complete picture of the patient, and not just the clinical, the omic factors, but also more and more really the future is where you are able to build in behavioral, environmental, and other factors which influence our daily health. So we've actually at Frost Sullivan made a big prediction on how social determinants of health is actually going to be driving that change and bringing shared benefits to operate in a truly precision health environment. So what does it mean? I mean, in the short run, for pharma companies, we see a quick move towards virtualization of clinical trials. On the diagnostic industry, point of care testing is making a huge jump, not just in by peripheral labs, but we've seen even other alternate sites, like retail clinics or at-home settings where patients are actually using that technology. And really, this is a time when we see an exponential jump in telehealth, especially virtual consultations by healthcare providers. So I think these are, really some of the future trends, we think this is a perfect, environment for Inovalon to sort of, leverage your platform, which is, bringing this integration of different technologies, be it, EHR or decision support systems, reporting tools, to really, bolster this analysis for better care, financial performance for payers, and enable the precision medicine in a truly realistic sense.
No, that makes sense. And I'm curious, you hit on some good points, and you're right. I mean, the leveraging or overlaying social determinants, on top of the core claims and clinical is so key, and we've seen that with a number of our products that gives a nice, much more rounded view, and frankly, it shows some very different aspects of consumers that and it helps you separate out the right approach. You talked earlier about the right intervention, the right time, the right patient. I mean, I think without knowing if they are living in a food desert or they don't have economic means for their medications, things like that, you really are, you have one arm tied behind your back. So it's a great point. I'm curious if I can ask you one question as we wrap up here is, I hit earlier the challenge in healthcare has been often the final mile, right? So that actually getting the consumer to engage, or the patient, right? The patient to respond. Even those that are have a good relationship with their provider, they leave, they go home, and on the way home they stop by the convenience store and they pick up the 2-liter of Coke, even though they're diabetic, right? So how do you see digitized medicine, smart devices? I have an Alexa in my kitchen. It reminds us of silly things. It doesn't actually remind us of important things, probably. How do you see smart devices, virtual, as you mentioned, virtual technologies? How do you see that changing or improving the final mile discussion that's kind of been pervasive in healthcare for a long time?
Yeah, I think that's a very interesting question, and also really talks about how technology is shaping not just work, but just entirely the way we are interacting, beyond the traditional clinical sort of infrastructure, right? I mean, it has progressed so rapidly. Some of the basic apps and tools are sort of, so easier and almost so pervasive in our daily life. For example, I was sort of talking to, one of our, clients, and, I didn't sort of realize that Alexa actually, a simple tool has actually 1,500 different, sort of, tasks and functions, right? And, in the last 6 months, I've learned so much, new things about such tools. It has actually, made my life pretty easy, even, when I'm sort of looking at, managing my day-to-day sort of work or even lifestyle sort of conditions, right? So it's just the awareness and also the way consumers have started changing their mindset of deploying technology on a day-to-day basis, and I think that's more important, right? As patients and consumers start thinking about it, using that frame of reference, really there is an exponential jump of how that thing could move. And from the point of view of using those tools, this is where we believe almost a significant chunk of understanding patient or human behavior lies. There's a lot of data which has now started coming in. I've looked at certain trials, clinical trials, which were recently approved, which have leveraged some of that real world data, and that's just been picked up by some of these simple tools or apps which are now actually a part of that variable set. So
right.
It has been a slow journey, but I think it's going to sort of move exponentially in the next couple of years.
Got it. Nitin, I really appreciate your insights today. It's been a great discussion. I would encourage folks, if they have any questions for Nitin or myself, the contact information is on the slide here. I'd love to hear from you. But thanks again, Nitin, for your time today, and appreciate your great insights in healthcare. Thank you all.